So we're going to talk about owning your health information. So before we do that, I think it's really important that we all start from a place where we all have a common understanding of what it is we're talking about. So by a show of hands, who's heard of HIPAA? Okay, almost everybody, right? Okay, so can anybody tell me what HIPAA stands for? That's the bonus question. Okay, good. I love what I'm hearing so far, and that's okay. It's, you know, we have a million acronyms in healthcare, and HIPAA is just one of them, right? HIPAA stands for the Health Information Portability and Accountability Act. And yes, there will be a quiz at the end. So write that. No, you don't have to write down. But you're right. HIPAA is really about, there's a couple of key words: information, portability, and accountability. Those are the key phrases I really want you to pay attention to, okay? Because we're going to hit those a couple more times in the half an hour or so that we have together this morning. So within HIPAA, there's yet another acronym. We love our acronyms. It's called PHI. Who's heard of PHI? Okay, I see one hand, so not as many. Do you know what PHI stands for? Go for it.
Personal health information.
I give you credit. Technically in HIPAA, it's protected health information, but HIPAA's been around. It'll be 30 years next year that HIPAA's law. And I think it has morphed into personal health information, and that is really, really important. Okay, one other question. Who here has heard of the one big beautiful bill that was passed? Okay. We can talk afterwards how you feel about it, but there's one thing there's one thing that I liked about it, and let me tell you what that is. The one big beautiful bill codified that you own your personal or protected health information. So my question to you is, what are you doing about it? And my goal this morning is to talk to you a little bit about why this is important, and then we're going to talk about strategies that exist right now, and then I want you to start thinking about what's coming in the future. And the goal is, hopefully when you leave this morning, you'll have a little bit of a call to action to take control of your personal or protected health information. That's what we really want to talk about this morning. So this is I like it to be interactive, as you can tell. So we're going to talk about some terms and jargon. My job every day is to translate medical jargon for people. I'm a professional patient advocate. My background, I have 32 years as a licensed physical therapist. I've spent the last 16 or so years as a healthcare executive, most recently as a COO for a home health company. Okay, so this is kind of my world. And I'm here really because I want to make sure that you understand how important this topic is. Okay, all right. So with that, I dropped something. Okay. All right. So let's talk a little bit more about PHI. Okay. So we live in the so-called information age, right? There's a ton of information, there's a ton of data, all of that. But when it comes to your health, I want you to kind of think about this PHI in 3 domains. Okay. I want you to think about the clinical domain. So that's going to be things like your labs and your diagnostics and your medications. Every time you see a new doctor, they do an interview with you, right? You've probably been asked the same question 100 times. You guys know how I see some people nodding, saying, yeah, I hate those questions, and I get it. But that's part of this discussion, right? So why is that happening? That new doctor is asking you the same questions because they don't have that information, and they want to make sure that they have that information so they can treat you and diagnose you properly and guide you to the right resources. So that clinical information is not just that hard data of labs and diagnostics and medications, but it's also that what we call the history and physical, and that's really, really important. So that's the clinical domain, okay? Then there's the administrative domain. The administrative domain is going to be things like your insurance information and your billing information. This is obviously really important because you want these services to be billed properly so that you're not facing a big bill after the fact. But this is also the information that a lot of cybersecurity experts will tell you is That's what the thieves want too, right? So there's an aspect of security here. The last domain is the legal domain. So by a show of hands here, how many people know what an advanced directive is? Okay, good. How many people have an advanced directive? Great. Okay. So advanced directives, that's a broad category for a lot of different documents, and there's no one size fits all here. So I'm just going to name a couple of them you've probably heard of. So a durable power of attorney for healthcare, a living trust, a living will, an estate plan. Okay. But even things like HIPAA release forms can be considered to be in that legal document or advanced directive domain. Okay. So again, 3 domains: clinical, administrative, and legal. Okay. And we're going to continue to talk about those 3 domains as we move through our discussion this morning. So I said earlier that you now, because of the big beautiful bill thing, you guys own your personal health information. What does that really mean? Okay. There's a couple things I want you to think about. Think about access to that information. So again, when you are seeing a new physician, maybe after Raz's talk, you're really inspired to go traveling and you're somewhere on the East Coast and God forbid something happens and you end up in an ER. You need to have access to that information, okay? And if you want to take them internationally, that's on you. Okay. You also want to make sure that you're looking at this information and that it's correct. So for example, how many people have taken a medication and then all of a sudden they went back to their doctor and said, you know what, you're doing fine. You don't need to take that medication anymore. Anybody have that experience? Okay, I see at least a couple people. Isn't it important to know at the time that you're giving that information that it's the source of truth for right now? If you stop taking that medication 3 months ago and your information that you hand to the doctor says you're still taking it, that changes how they evaluate things, doesn't it? Really important, okay? But maybe most importantly is your ability to share this information. And that's really where you start to own your health information. What do I mean by that? So again, I used a term just a minute ago, I called it the source of truth. This is the most important thing that you can do to be a participant in your health, is you need to know what the source of truth is. You don't need to know what all those terms mean. You don't necessarily need to know what all those medications do, but you need to know that it's accurate right now. And that's what's really, really important. So more rehospitalizations occur across the country due to errors in medication administration. It is the number one reason why patients return back to the hospital. And that's typically because the information that's given at discharge is typically in a nice envelope that's probably that thick that will make your head spin if you try to read it. So getting that information out of that packet becomes very, very challenging, right? And again, medications are something that I'm going to continue to harp on because I think that's our highest risk. Okay. Any questions so far? Okay. So we're going to talk about kind of the existing ways right now that we manage our information. Okay. There are people that are going to walk around with something that looks like this, right? How many people have that? Anybody have a binder where they keep all their information? I see at least one person. Okay. So you know, and look, that's okay. Some people still get the newspaper delivered too, right? I mean, some people want to touch and feel and hold, and that's okay. You know, and in the digital world, that's changing every day, right? I mean, all that stuff is kind of being pushed online and so on, okay? But if we're going to organize things in a binder, what do we need to do? We need to organize it, okay? We need to say, here is my clinical tab with all my medications, my labs, my history and physical. Here's my administrative section with my insurance information and my billing information. And lastly, and I'll argue as importantly as anything else, here is my legal section that has my advanced directives. Why? Well, if you think about it, why do we put advanced directives in place? This is a conversation no one likes to have. We don't want to think about our own mortality. We don't want to think about getting sick. We don't want to think about being in a situation where you might not be able to advocate for yourself, right? But that durable power of attorney, that's why that's there. And so you need to make sure that that is included with that health information. And almost as importantly, you have to make sure that that person that you designated as your POA, your power of attorney for healthcare, they know what the document says and they know where to find it, okay? In my years operating as a home health executive, we would get patients from hospitals, from skilled nursing facilities, from doctors' offices. And one of the questions we're required by Medicare to ask is, do you have an advanced directive? And almost everybody, kind of like here, probably 80, 85% of the people are going to say yes. And then we'd say, can we get a copy of that? And what do you think the response is?
Oh,
What was it?
I don't know where it is.
I don't know where it is. I'll try to find it for you. I'll send it to you. Do we ever get it? Maybe 8% of the time, you know? So you go through the exercise of putting all this together because it's a tool for you to use. Yet it's often not considered as part of that record. So I really want you to think about that as you're thinking about owning your health information, okay? So the next most common, or maybe not most common, but the next most accessible way that people are managing their health information is through the cloud, right? Everybody's heard of the cloud. Google Drive, Microsoft OneDrive, Apple's got one, and these are very useful tools. Excuse me. They're great, right? So what's great about them? They're safe, right? Apple, Google, and Microsoft, I mean, these are the companies that do cybersecurity all day long, right? So you feel pretty good about having that information there. You feel like it's pretty secure. And most of them have the ability to share it with somebody. So, for example, on your Google Drive, you can choose to share it with your POA, and you can control what they can do with it. You can say, I only want them to view it, or I want them to be able to view and edit it, or some other options there too. But the nice thing about that is, again, now you can go on a trip with Roz, and anywhere in the world that you are, you can get that information. That's pretty cool. You don't have to lug around a binder and you have some extra room in your carry-on, right? Because you're not carrying this big binder with you, okay? Equally as cool is you can share that to the hospital whose ER you're in if you needed to do that, right? So that's pretty awesome. Again, you want to make sure it's organized into those three domains: clinical, administrative, and legal, so that people can find that information quickly. If you're in an emergency room and it's truly an emergency, we don't want to have to open a million documents to figure everything out. The insurance information isn't that important at the moment. What's important is the clinical information. So let's get to that, okay? You also need to make sure that your family, your friends, people you trust, whether it's an attorney, maybe it's Brian, everybody trusts Brian. It's true. I promise you it's true. And so, again, you want to make sure that they have access to that in the event that you're not able to access it yourself. Maybe you're in a different state of mind. Maybe you're in so much pain you can't remember your password or whatever, okay? So cloud-based, very, very good. How many people here have a MyScripts or a UCSD portal? Okay, probably about half. Okay. This is probably the other most common way that people are managing their health information. And there's tremendous attributes to this. Scripts, I'm a Scripts patient. My Scripts portal has information going back almost 20 years. They have uploaded labs and diagnostics and assessments from years and years and years, right? So what's nice about that is you have this longitudinal view of your health information and your health history. It's kind of really nice to have. You can communicate with your doctors through there. You can send them messages, right? Hey, doctor, I'm traveling with Roz. We're on this great trip in Italy, but I ran out of blood pressure medication. Can you help me get a blood pressure med called into a pharmacy, right? I mean, that's pretty far-fetched, but it could happen. It could happen, okay? All right. So, again, some of the other things, so the messaging is secure. When you send your doctor a message, it's only going to your doctor. It's kind of nice, right? You also have the ability to see your appointments, both future and past. So if you're in a situation where you need to give someone information, let's say in an ER, and you have access to that app, you can do that right then and there. That's kind of nice too. So again, source of truth coming from your mouth. It's kind of nice, okay? What are the cons or the drawbacks of using a portal like this?
Passwords.
Thank you. In case, what was your name? In case we didn't hear what Bina said very loudly and clearly, she said passwords. So multiple logins, some technology hurdles there absolutely are issues. There's no question about that. Okay. But also tangential to that would be, again, if you're not able to access it yourself, maybe you lost your phone, maybe again, you're in a state of mind where you can't achieve that. It's important that your DPOA, your durable power of attorney, has that information too, so they can help you from afar. Okay, there are some limitations there. The other limitation I want to say is this: you can export that data, you can send it to yourself in a PDF form, and maybe store that digitally, but it's not. You cannot get another. So let's say you're again with Roz, and I'm going to choose Florida. You're in an ER in Miami. They won't be able to access that portal unless they have your login information. And there's also HIPAA release forms that they will need to execute in order to do that. So what does that cost you? Anybody know? Who said that? Time. It costs you time, right? And so that's critical. If you're in an ER, maybe, God forbid, showing signs of a stroke and you can't articulate what you need to articulate, it's going to cost you time, critical time. And that's a limitation. Great answer. So best of both worlds, again, there are people that are going to choose a bunch of different hybrid approaches. Maybe somebody has their backup information in a binder and they have it on a Google Drive. Or maybe they're using MyScripts, and they also have that stuff exported to a Google Drive that their DPOA has. So you don't have to choose one, you can choose several, okay? All right, so let's talk about what's coming next. So, in healthcare, we love data. There's a ton of data, a ton of information, right? And so when we talked earlier about HIPAA, we defined it as the Health Information Portability and Accountability Act. So really what's coming in the future is the portability and the accountability aspect. Anybody here have heard the term interoperability? Anybody heard that term? I see a couple hands. Does anybody want to say what that means? Offer a guess? Don't be shy. Okay, I'll help you. So interoperability really means that one system has the ability to talk to another system in real time and produce that source of truth that we're going after, okay? So what that means is if you're a Scripps patient and you're in Miami with Roz and something happens, that Miami's hospital has the ability through a connection to get the information from your Scripps account. That does not exist so beautifully today. And there's a lot of reasons for it. But, and that's too technical of a conversation for the time that we have this morning, and it would probably put half of you to sleep. But maybe me too. But the point is we are working toward interoperability, but there are a lot of legal and technological and security concerns that have really prevented us from moving in that direction, okay? But what is coming? Anybody here have experienced in their home a remote patient monitoring? Maybe blood pressure? I see a couple hands, okay. So this is what's coming. And I read a quote the other day, literally just the other day, it was perfect timing. And they said, if we're gonna fix our broken healthcare system, and our system is broken, folks, make no mistake about it, but if we're gonna fix this system, we have to accept the fact that 90% of healthcare in the future will be community-based. What does that mean? That means we're not going to receive most of our care in a hospital setting or a skilled nursing setting like we have in the past. Okay, really, that's really an incredible concept. So all these remote patient monitoring, the ability to gather data from real time in the field, even your Apple Watch can gather a ton of data that is very, very usable and important for a physician to look at and make some inferences based on what they see. So this is what is coming. But again, your protected health information is your information, and it is absolutely what cyber crooks want, right? Think about that data. It's everything they need to steal from you. It's your name and your address, and it used to be your social security number. It's not anymore, thank goodness. But they can reverse engineer a lot of that information if they have enough information about you. So it's important that security is a part of this, okay? So what is coming ultimately is with all these wearable technologies, remote patient monitoring, there are systems that are coming online that are focused on you as the center point as opposed to my scripts as the center point. Think about how different that is. Right now, your information is inside of that system, but you own it. Can you always get it? Do you remember your password, Vina? Right. So now where we're moving is there's going to be systems that are coming out probably in the next 6 to 12 months. You'll start seeing, and with AI, it's happening faster, where now instead of making scripts the focal point, you are the focal point, right?
Are those for profit?
It's across the board, but yes, usually it's going to, what we're seeing right now is probably like a subscription-based model. Where, and of course there's other services that they're going to add on to that and offer you. But yes, typically that is going to be a for-profit model. Great question. So again, what's really important here is that we're sharing that information with our DPOA, with any trusted service provider, attorney, a wealth manager, an estate planner, a fiduciary, any of those people that you're going to trust to help you in crisis. They need to be able to be included in that. And that information will be organized in a very similar way. Clinical information, legal information, administrative information, okay? All right, so everybody's probably heard the phrase, information is power, right? I know I've heard that a bunch of times, and I believe it. So your PHI is your property, it's your power. It's your power to control what's going to happen to you to the best of your ability. You're a human being, I'm a human being, we can't always predict the things that are going to happen, but the best thing we can do is be prepared. So much like you might go to my friend Andrew in the back, who's a wealth advisor, for expertise in investing, and he's going to interpret the jargon of the financial world for you. He's going to give you strategy, and when you go to make a decision to invest your assets, he's going to give you confidence in the decisions that you make. What I do is I do the same thing, but for health, right? That's the goal. The goal is to make sure that you are managing your most valuable asset, which is your health, okay? I'm going to ask you guys to consider taking action even today, this week. Think about how you're organizing your information. Think about who has access to it. Think about how you can make it more portable. Think about how you can make it more accessible. This will help you. It takes a crisis situation and it brings the temperature down several notches because we now have the source of truth that you control.